Start smart for your baby. Overall goal is healthy moms, healthy babies. Everything we do, we are trying to just drive that positive health outcome and hoping that that positive health outcome continues on while baby continues to grow. For our pregnant population, it's helpful to have nurses that do the work because they can talk to the member about the symptoms they're having, about the stages of their pregnancy, what they can expect. Being a nurse, you can explain to that member what those effects are on mom and on baby.
My role with Home State Health is a registered nurse care manager. What I do in my position is work with high-risk moms. So I focus on the area of Start Smart for Baby program. And what I try to do is make sure the mom carry the baby to at least 37 weeks or more and try to prevent NICU stay or NICU admissions and prevent hospitalization and decrease the amount of ER usage. When I first get that notice of pregnancy, I first look at the memory report and I go on there and look at their medical history and things like that. I'm getting a glimpse of you. When I talk to you, I'm hearing you. I'm trying to figure out what's your emotional need, what's your physical need, what's your spiritual need, what's your mental need. I see you, I hear you, and I feel you. I'm going to be genuine, I'm going to be truthful, and I'm going to be consistent.
Nurses are the most trusted profession that there is. We need that trust to be able to work with members. You are not going to communicate, answer the phone, tell someone what's going on in your life if you don't trust them. So our nurses are really important to establish that trust, to get a understanding what's going on in each individual member's life. But I can guarantee you that our nurses and every nurse I've ever met is always on your side.
I was going through my pregnancy and she called me one day to see how my pregnancy was going and if I needed anything. And I was like, well, everything going good, but I would love a breast pump. And she was like, well, I can give you some resources. I was like, okay. She was concerned with my pregnancy, my health, the baby, how I was being treated, and what could she do to help me more. I felt like she was a friend, like she was family. Like, it felt real good. It felt welcoming, like we knew each other.
The best part about my job is when I see that the mom stay healthy, my mom get the tools and resources she need, and she have a healthy baby, carry that baby to 37 weeks or longer, and the baby not ending up in NICU, and then they able to advocate for themselves. They able to feel confidence with themselves. We continue to work with that member 60 days after delivery, and we advocate and we referring, we providing resources. So we just walk them all the way through it. And then, and we always say, hey, if you need anything, give us a call. We're here.
Miss Felicia, I think I want to give her flowers now because she always called me and made sure everything was going good with me. With all my other kids, I never had the outreach like I did with her. So I was real grateful for it and I really didn't know what to expect. I look at life as it takes a village to raise a child. And she's a part of my village now. I really appreciate her a whole lot.
We celebrate our purpose of transforming the health of the community one person at a time. We celebrate that with our care managers. We say, yay, look at this baby. We've had moms who email pictures in of their babies, and we just rejoice every time. That individual member is how we value what the outcome of the program is.